Introduction. Abortion is very important topic in medical, surgical, nursing and healthcare education. It involves not only understanding the biological and medical aspects but also the psychological, social and ethical issues surrounding it. In this session, we will learn about the abortion, its type, causes, methods, complications and the nursing management. Definition of abortion. Abortion is defined as the termination of pregnancy before the fetus reaches viability, meaning before it can survive independently outside the mother's womb. Medically, abortion refers to the expulsion or removal of an embryo or fetus from the uterus before 20 weeks of gestation. Classification of abortion. Abortion can be broadly classified into two main types: spontaneous abortion and induced abortion. First, spontaneous abortion. Spontaneous abortion, commonly known as miscarriage, occurs naturally without any deliberate medical or surgical intervention. It can happen due to a variety of reasons, including genetic abnormalities, maternal infection, hormone imbalance, or anatomical issues with the uterus. Types of spontaneous abortion include threatened abortion, characterized by vaginal bleeding without dilatation of cervix. Pregnancy may still continue with proper management. Inevitable abortion. Vaginal bleeding is accompanied by cervical dilation and the process of abortion cannot be prevented. Incomplete abortion. Some parts of the fetus or placenta remain inside the uterus. Complete abortion. All products of conception are expelled from the uterus and usually no further treatment is necessary. Missed abortion. In this type, the fetus has died but remain inside the uterus for an extended period without immediate symptoms. Septic abortion. These occurs when abortion is completed by infection due to the unsafe or illegal abortion procedure. Recurrent habitual abortion, defined as 3 or more consecutive spontaneous abortions. Induced abortion. Induced abortion is the deliberate termination of the pregnancy through medical or surgical means. It is performed either for medical reasons or at the woman's request. Types of induced abortion includes: first is therapeutic abortion, conducted when the continuation of pregnancy poses a risk to the mother's life or health or when the fetus has significant congenital abnormalities. Second is elective abortion, chosen voluntarily by the woman for personal, social or financial reason without medical necessity. Methods of induced abortion. Induced abortion can be performed using a medical or surgical methods depending on the gestational age and the woman's health condition. Medical method involves the use of medications to terminate pregnancy, typically up to 9 or 10 weeks of gestation. Only the drugs are mifepristone, which blocks progesterone required to sustain pregnancy, followed by misoprostol to induce uterine contractions and expel pregnancy contents. Surgical methods. Surgical abortion includes several techniques: manual vacuum aspiration, a suction technique used to evacuate the uterus usually up to 12 to 14 weeks of pregnancy. Dilatation and curettage involves dilating the cervix and scraping the uterus wall to remove the pregnancy tissue, typically done in the first trimester. Dilation and evacuation performed after 13th week of pregnancy using suction and surgical instruments. Induced abortion. Medications like prostaglandins or oxytocin are used to induce labor and expel the fetus, generally for second trimester abortions. Hysterectomy, a surgical procedure similar to caesarean section, rarely performed. Cause of abortion. The cause of abortion can be categorized into maternal, fetal and external factors. Maternal factors: conditions like uncontrolled diabetes, hypertension, thyroid disorders, uterine abnormalities, infections such as torch, toxoplasmosis, other rubella, cytomegalovirus, and herpes. Fetal factor: chromosomal abnormalities are the most common cause of early pregnancy loss. Genetic defects or developmental anomalies may also contribute. External factors: trauma, exposure to harmful chemicals or radiation, certain medications, and unhealthy lifestyle habits like smoking. Complications of abortion. While abortion can be safe procedure, complications can sometimes arise. hemorrhage, excessive bleeding, infection. If any products of conception remain or if sterile techniques are not maintained, infection can develop. Uterine perforation, accidental puncturing of the uterine wall during surgical abortion, cervical injury, damage to the cervix, incomplete abortion, retained products of conception can cause bleeding, infection. Psychological impact, some women may have experienced grief, depression, anxiety, or post guilt abortions. Nursing management in abortion. Nurses play a vital role in managing patients undergoing or recovering from abortion. Nursing care includes assessment, monitoring vital signs, assessing amount of bleeding, evaluating pain level, interventions, administering prescribed medications such as antibiotics or uterotonics, preparing the patients for surgical procedure if necessary, maintain sterile technique, providing emotional support and offering counseling regarding future pregnancy planning and contraception. Post abortion care, encouraging rest, hydration, proper perineal hygiene to prevent infection, advising avoidance of heavy work and sexual intercourse for a few weeks, and scheduling a follow up appointment to ensure complete recovery. Legal and ethical aspects of abortion. Abortion is surrounded by significant legal and ethical consideration in India. Abortion is regulated by the Medical Termination of Pregnancy (MTP) Act 1971, which allows abortion under certain conditions such as risk to maternal health, fetal abnormalities, rape, or contraceptive failures in married women. Consent from the pregnant woman is mandatory and confidentiality must be strictly maintained. One qualified and registered medical practitioner are authorized to perform abortions in approved healthcare facilities. Conclusion. Abortion is a complex and sensitive aspect of reproductive health care. It involves medical, emotional, social and legal factors. As future healthcare providers, nurses must be well informed about the types, causes, methods, complications and nursing managements related to abortion. Providing empathetic care, accurate information, emotional support and maintaining ethics standards are crucial in handling abortion cases.